Let's go. My name is Dr. MarkAlain Dery, and I'm the Medical Director of Infectious Diseases and Chief Innovation Officer for Access Health Louisiana, and I live in New Orleans, Louisiana, and I serve as co-chair for the ACOI Infectious Diseases Subspecialty Section. As providers, we have drastically seen how the realm of public health has influenced our professional lives. And whether we serve in academia, in administration, in research, in private practice, or within the hospital setting, or all the above, COVID has become synonymous with the term public health recently, and it has dominated our dialogue over the last year and a half, and rightly so. But we all know that there are other issues that deserve attention too. So together with the ACOI, hello, ACOI. Thank you for letting me make these videos. We will continue to share information on COVID-19, and now we are expanding our coverage to include other public health concerns as well. So let's get started, and let's talk about one of my favorite topics, which is equity in healthcare. Now, as we've discussed many times during this video blog, in the last 16 months, the COVID-19 pandemic has universally surfaced inequities in medicine. Now, a study from researchers at the University of Minnesota and Hennepin Healthcare Research Institute was recently published on the JAMA Network Open, and it was one of the first studies to examine testing for COVID-19 and how different socio-demographic groups use telehealth, outpatient clinical care, emergency department, and inpatient care to test for SARS-CoV-2. Now, for those of you who may not know, the JAMA Network Open is an international peer-reviewed open access general medical journal that publishes research on clinical care, innovation in healthcare, health policy, and global health across all health disciplines and countries for clinicians, investigators, and policymakers. That's why it's called Open at the end of JAMA Network Open, because it's open. Anyway, what the study revealed was that patients who initiated COVID-19 testing through telehealth were disproportionately white and English speaking. In contrast, patients who initiated testing through the emergency department were disproportionately Black, Native American, non-English speaking, and had one or more coexisting or pre-existing conditions. Now, also interestingly, testing that was initiated through telehealth and outpatient encounters was associated with lower rates of subsequent inpatient and intensive care unit care testing that was initiated in more intensive care settings, such as emergency departments. So the natural question is why? The study pointed to structural root causes, which included delays in seeking care, barriers to timely access, specifically to testing, putting off seeking care, and difficulty in accessing telehealth and other higher rate of pre-existing conditions that require higher levels of care, hence needing to be in the hospital. Now, for many of us providers, we have seen the results of when communities of color delay care. Often it is delayed due to a fear of how they'll be treated, and it is linked to a history of racist events in medicine, including Tuskegee syphilis experiments that caused endless suffering for generations of Black Americans. Now, we saw that play out a few months ago when the CDC released data that showed that Black Americans had the lowest vaccination rates of any ethnic group. And a Kaiser Family Foundation poll at the time found that 35% of Black Americans said that they would not get the vaccine due to concerns about trust, safety, and also because of the newness of the vaccine. Recently, a story came out that has brought to light just how dangerous vaccine hesitancy is. Martin and Trina Danielle, ages 53 and 49, who both died on July 6th of COVID-19 and married 22 years, decided not to get the COVID-19 vaccine because of their mistrust in medicine based on the Tuskegee syphilis study. The study was conducted at the Alabama College, where Martin ironically graduated from college, and that was part of his making the decision for him and his wife much more personal. That gave that mistrust led to a fatal outcome and cost both of them their lives, sadly. And as you may know, Alabama has the lowest percentage of fully vaccinated people. In Mississippi, Arkansas, and even in my home state of Louisiana, we have less than 36% of residents who are fully vaccinated. And that's just one story of many of how distrust in medicine and inequity in care continue to hurt communities of color, and why I am so happy that the American Medical Association, the AMA, has released an 86-page organizational strategic plan to embed racial justice and advance health equity. Now, the AMA's Health Equity Task Force describes the paper as a roadmap to embed racial justice and advance health equity for years to come. The report is getting a lot of attention as more physicians, now more than ever, are speaking up about racial injustice. Now, physician organizations are hearing more from their members about combating systemic racism. Not surprisingly, young people, students, and residents have been leading the charge. Good. Some will argue that physician associations are perhaps not the strongest way to lead transformational action on racial health equity. However, physicians like myself who are seeking racial equity can enlist physician associations to help raise awareness. For the ACOI, the Committee on Health Equity and Inclusion in Medicine works to address issues related to underserved minority populations in continuing medical education and graduate medical education programs, as well as to discuss areas in which the college may wish to create policy statements and provide advocacy regarding health equity and inclusion in medicine, and to improve diversity in the pool of individuals recruited to careers of internal medicine. How awesome is that? Now, I hope that things like this and doing this video blog will help disseminate important information regarding the impact of cultural differences on healthcare provision and outcomes. And to check out more on the Committee on Health Equity and Inclusion in Medicine, go to the acoi.org video. I'm just so proud to be part of an organization that focuses on equity and inclusion and how to remove disparities in medicine. And so important for us to support that. All right, so let's talk about something I don't support, something that would be the opposite of a gold medal. Like, I can't even think of it. Like, an opposite of a gold medal would just be like a medal, and that's what we're going to talk about next, because the Olympics during a pandemic is, not good, okay? Many times, the context of public health refers to the United States. That's oftentimes what we talk about. For those of us that are globally minded, we think about global public health issues as well. And the one that I am looking at right now is the one that deserves a medal. And that is the 2020 Olympics, moving forward now in 2021 in Tokyo. First of all, you can't call it the 2020 Olympics when it's in 2021. You know that you have a problem. But anyway, we are seeing a public health dilemma that is bound to impact every country on the planet. And the dilemma started with the decision to move forward with the Olympic Games. Now, albeit the Olympics are without an audience at most events, but nevertheless, my concern has been the potential for these games to result in a, you said it, super spreading event. Yes, this will be, and it has been, a super spreading event. Wow. What happens when you bring a bunch of people together from all over the world and, in the middle of a pandemic? I don't know, with a Delta variant that is really massively infectious, I can't imagine what's going to happen. But I've got the statistics, so I can tell you what's going to happen right now. So first, let's look at the fact that less than 10% of Japan is fully vaccinated. So we're bringing people from all over the world into a country where there's less than 10% vaccination. Yet, despite that, this is happening during a historic pandemic. It is expected to be the most profitable yet for U.S. TV stations in regards to advertising. And that, ladies and gentlemen, explains a lot. In fact, NBC Universal sold 90% of its advertising inventory by March of 2020 and hit a record of $125 billion, beating out the Rio Olympics in 2016, which recorded a massive $250 million profit. So this is 4 times that amount. God, the monies that they bandy around here. All right, few of us realize that the Tokyo Medical Practitioners Association wrote an open letter in May to Japan's prime minister recommending that the games be canceled. They cited health concerns. Of course they did. fearing a COVID-19 outbreak? Of course they would. That would be associated with the event. And as a result, what that could mean as far as the disproportionate burden that would place on the country's health system. Of course they did, because that's the right thing to do. Also, a survey reported that 83% of the Japanese population wanted the Olympics called off. Now, while organizers required visiting athletes to follow a 3-day quarantine upon arrival, many are saying the requirement felt unenforced and that there were crowds mingling at breakfast buffets. Jeez. All right. In addition, the Health Monitor app that was required has failed to work. The people really at risk here are the Japanese people, with a full 90% of them being unvaccinated. The rollout of the vaccine in Japan has unfortunately been abysmal, and those who have had the first shot have had their second shot appointment canceled due to a lack of supply. And of course, the highly transmissible Delta variant is increasing the risk and is accounting for at least 30% of the cases in Japan. And as of July 29th, the 7-day average of COVID cases in Japan rose from 1,589 on July 2nd to, are you ready for this, 6,657. That went from 1.5 thousand to 6.6 thousand on July 29th, breaking records, both in the Olympic Village, that's what you get for your Bach medal, and throughout the city of Tokyo. As of today, the total number of infections within the village is 193, with 24 more cases being reported July 29th. Citywide new cases across Tokyo reached a record of 3,865 on Thursday. The third straight day the city broke case records. Blah, medal. Yet the International Olympic Committee has come out publicly to say it is highly unlikely the games are the source of infections. That said, I've had a moral dilemma as to do I boycott watching the games or not. I'm not a big sports watcher, but I am a fencer. I used to fence back in the day. I used to have a national ranking, and so I do enjoy watching the fencing in the Olympics. And so I feel as though these folks have been working their whole lives to get to the Olympics, and so I would like to boycott Olympics 2020, but boycotting the athletes I refuse to do because they have worked so hard, and they are literally putting their lives on the line. And the female épée fencing was amazing. Check it out. All right. Stay on the lookout for these updates, and for more from these sources that are used in this report, go to the acoi.org acoi.org/resources together with the ACOI. Thank you, ACOI. We'll help you have the latest information to help you respond to your patients. Also, feel free to reach out to me. I love hearing from you at madery@mac.com. Thank you, Gina Kilker, for another brilliant script. Please stay safe.